Hey everybody, welcome back to the Heartbeat Debrief. My name is Devin, as most of you know, and I'm your host. Today, before we dive into the episode, for those of you that are watching, you'll notice that this is my first solo episode. So far in the podcast, all of the videos have been guest episodes, so I'm trying something a little new today. So please bear with me. I promise we will make it through to the end of this episode. Second, I want to give a shout out to all of the nurses out there, as it is Nurses Week as I am recording this. Thank you for everything that you do. Okay, whether you are working at the bedside in the hospital or in the clinic or transport, or maybe you left bedside nursing and you are out there living your best life, doing something that the majority of us can't even dream of. Okay, whatever it is that you are doing, know that you matter and know that you are making a difference. So from the bottom of my heart, thank you so much. Now, today's episode. Today's episode feels like a really good one because the topic that we're talking about is something that we could probably all use a little bit of polishing up on. And we're talking about crisis management, okay? How to stay calm when shit hits the fan. And if you're a newly licensed clinician or a new grad, you've probably been thrown into some situations that you probably weren't ready for. And we're gonna talk about all that today and some tips and tricks that have kind of helped me along the way in my career. So I hope you enjoyed today's episode. Let's get into it. We all know that healthcare can be chaotic, okay? Whether you are a healthcare professional or whether you're a patient or whether you're a family, chances are you've had a moment where everything felt like it was spiraling out of control. And in those moments, it can be really hard to stay calm. But staying calm is exactly what you have to do in order to succeed. So today I want to talk about how we get through those moments without completely losing our marbles and having good outcomes. And I don't want to pretend that crisis doesn't affect us, because it absolutely does, okay? This is about what we do in those moments to help us think clearly and communicate well and actually help the situation instead of making the situation worse. So let's start with what we mean when we say crisis in healthcare, okay? Crisis can look like all kinds of things. An unexpected emergency, a staffing shortage, a natural disaster. Here's a good one, a pandemic, okay? All of those things mean crisis. And it's important to remember that crises are part of the human experience overall, okay? They happen. They're nothing to be ashamed of, and they're definitely not something that we should hide away from. Embrace the crisis. But why do we talk about crisis management? Because when we talk about things, we can normalize it. We can fight things that we name, right? You remember that from another episode? Okay, but the crisis that I experience in the NICU is going to be very different than the crisis that I experience on mobile stroke. That's very different than the crisis that I'm going to experience at the music festival a week from now. The definition of crisis at its core is the same. Okay, it's going to make you feel like you are alone, but you're not. Okay, crises are universal. And when we talk about them and when we name them, we can learn from each other. We can fight them. We can become more resilient. Okay? And honestly, I think that's one of the biggest things that healthcare teaches us over and over and over, right? You are going to have hard days. You're going to have moments that you feel like you're barely hanging on. But those moments, those crises, does not mean that you're doing it wrong, okay? It means that you're in the middle of something difficult. So I want to break this down into a few different components. Stay with me. Number one, staying calm. And I know it's easier said than done, but how many of us remember in EMT school or paramedic school or nursing school, whatever path you took to get here, right? You had an instructor at some point throw out some ridiculous scenario that you had absolutely no idea how to handle. Okay? I know I did, okay? Your brain goes completely blank and you freeze. You start to panic internally, especially you're in front of your classmates, okay? You start thinking, what do I do? Who do I call? Why am I here? Why did I choose this career? Okay, we've all been there. We have all been there. And Honestly, I would say I still probably get that little flash of panic when I walk into something that I've never seen before, but that doesn't make me bad at my job. Okay, that makes me human. Okay, when we sit and we think about that, right? When crisis hits us, our body goes into fight or flight. And that's where people either start making rash decisions, or they freeze completely. Neither one of those is what we want, okay? One of the biggest things that I have learned in my career is that you just have to pause and breathe. Just breathe. Because it's not our emergency, and it never will be. I remember when I was a young EMT, I was driving to my first cardiac arrest. I was shaking, I was nervous, I was probably sweating, and my partner looked at me as I was driving and he was like, hey, slow down, take a breath, and let's just get there. Okay, we are no help to them if we show up discombobulated or not at all. Okay, it is not our emergency. Let's just breathe. And that has stayed with me ever since. Because it's not my emergency. Why am I so worked up? Okay? I need to walk into that situation and be calm and collected. So now when I walk into something unfamiliar, I try to take 10 to 15 seconds and just breathe. I look at what I'm walking into and I figure out my plan before I do anything. Okay? I don't need a whole dramatic speech in my head. I just need a second to collect myself. And I know that sounds simple, but for me, it works. And deep breathing, studies have shown, deep breathing can help slow your heart rate and stop your brain from spinning and spiraling out of control, okay? You inhale, hold, exhale, and you do that a couple times and it'll bring you back down enough to think clearly. Now, I'm very familiar with this because I practice yoga on a regular basis. And breath work is a huge part of that. It helps me find my center. And even if yoga isn't your thing, you can still come back to your breath whenever you need to. It is always there for you. And I think that's something that a lot of people forget. You don't need big, overcomplicated interventions in the moment. Just a simple breath. In and out, couple seconds to bring yourself back. Now, you're thinking, that sounds dumb. I don't like that. The military uses it, okay? It's called tactical breathing. Tactical. Which is basically just a structured way to calm yourself under pressure. You start by exhaling all of the air out. You inhale for 4 seconds through your nose. You hold that for 4, and then you exhale for 4, and then you pause for 4. And then you repeat. Very simple, very effective. And if you want to make that even more practical, use it before you walk into the room, before you answer the phone, before you go talk to a family, before you jump into the next task. That little pause can change the whole tone of what happens next. So remember your breath. Next, assess the situation. Those moments that feel like everything is falling apart, 3 ambulances coming in at once and all of them need trauma bays, 2 crash C-sections that are happening and both babies are extremely premature and you don't have enough staff to admit the micro-preemies. Or maybe it's that you have 10 pending calls in the city and you're down 4 ambulance crews tonight. Those moments, okay? That is when you have to take a step back and ask, what is actually happening right now? And this is where the first breath comes in. Okay, that little pause gives you a chance to gather your information and understand the facts. Okay, it allows you to figure out what resources you have to work with. Then you can move forward with the decision and decide what to do instead of just reacting to the chaos. Okay, depending on the situation, that might mean that you're going to check in with your team. You're going to review patient data. Or maybe you're going to reach out to another department or organization for support, okay? That pause that you were taking, that pause and the assessment, those 2 things are the difference between a controlled response and a full-on disaster, Okay, a really good example for me is I was working a music festival and we had really, really strong winds rolling in. And we knew this, we were prepared. We'd already talked about the possibilities of shutting down a stage or evacuating parts of the venue, whatever we needed to, okay? The team was all on board and prepared. Well, during this windstorm, a massive overhead sign leading into an area of the venue started swinging around like it had completely lost its mind. Okay, that has to be dealt with. But how do we deal with that? So we called it in, and then we took a moment and assessed the situation, and we started figuring out the safest way to handle this situation. Because we have thousands of people walking around under this huge sign, and if it comes crashing down, it's going to seriously injure somebody. So the few of us that were in the area paused, took a moment, and we assessed what needed to happen, okay? We ended up calling in 3 other departments. We blocked pedestrian traffic from the area. We ended up bringing 2 boom lifts into the venue and take that sign down. And then we reopened to pedestrian traffic, and it went off very smoothly. But what I didn't want to do is I didn't want to cause a panic, and I didn't need to evacuate the whole venue. I didn't even need to evacuate that portion of the venue. I just needed to shut down sections of it to get the boom in, okay? But it's very stressful. But I wanted a clear picture, and I wanted to make a smart decision. So I took a pause with my team, and we discussed and we assessed, okay? Assessment is not wasting time. Assessment is what keeps us from wasting time later to fix a mistake that could have been avoided presently. Okay, that is true in festival medicine, in an ambulance, in the NICU, in the ER, and I'm gonna say in life in general. Pause, assess, act. Now, let's talk about communication. Because in a crisis, communication matters a lot. That means being clear with your team, your patients, and sometimes even the public if needed. It means saying what you mean, but saying it plainly and making sure that the message actually lands. And this is where it can get messy because a lot of people start talking like everyone can read their minds. But how many times have we heard commands thrown out into thin air during a resuscitation? All the time. It's what I like to call thin air commands. And if you've taken a class with me, you know that I talk about this all the time at NRP. Somebody says, I need epi now. Can I get a 2.0 ET tube? Nobody is acknowledging, nobody answers, nobody confirms that they heard it. Okay, it just hangs out here in limbo, in thin air, and we are all pretending that that is enough to get us through this resuscitation. Wrong. Okay, thin air commands are bad patient care. What we want is closed loop communication. And what that means is that you say the person's name, you make the request clearly, and then that person repeats it back to you to confirm that they heard you. So instead of yelling into the void, you say, Ashley, can you please get me 1 milligram of IV epinephrine? And Ashley says, yes, getting 1 milligram of IV epinephrine. That way, everyone knows what's happening. There's no guessing, no confusion. It's all laid out. And I know that I'm probably preaching to the choir because how many times have all of us taken ACLS, PALS, NRP, insert whatever 3-letter certification course you want here, but still somehow our communication turns into absolute trash when things get stressful. Okay, we all know better, so why don't we do better? Okay, people just get sloppy. Okay, people get disorganized, and it shows. In addition to that, tone matters. Okay, it's not just what you say, but it's how you say it. If you sound frantic, if you sound clear, if you sound steady, okay, all of these things matter. And people have a much better chance of staying focused when you sound calm and collected and not frantic. So we all need to do better to communicate during crisis situations. Now, what about talking to families or patients during a crisis? That is a whole different skill level. And for me, I try to do the same thing. I pause, I compose myself, and then I speak to them in a calm, understanding, non-medical jargon manner, okay? I explain what's happening. You have to remember to slow down, be human. And if you're not the primary care provider, then it can be really helpful to have someone step in and handle the conversation. Or if you are the best person to answer those questions, then you need to step back and answer those questions, okay? Or find the person to answer those questions. Maybe it's the charge nurse or the resource nurse or the physician or the squad supervisor or the company officer. Whoever is best suited for that moment is who needs to talk to the family. Because I guarantee you, if you can help manage the family, you can manage the situation overall. And families remember these types of things, okay? Families remember how you made them feel. They remember whether you slowed down enough to look them in the eye. They remember whether you used words that they could understand or whether you buried them in medical jargon, okay? They may not remember every little detail of what's happening in the moment, but they're going to remember whether they felt ignored or cared for. And that matters because in those moments, those families are terrified and they don't need perfection. They just want honesty and clarity. So communication is not just about the patient in the bed or the team that's taking care of them. It's about everybody in the room. 4, teamwork. Teamwork because nobody should have to weather a crisis alone. And that's why so many of us develop these trauma bonds with our coworkers. Whether you work on an ambulance, in a fire truck, in the ER, in the ICU, or really anywhere else where this job can get really heavy really fast. Okay, we build this support network of coworkers and friends and family who can help us navigate things when things get tough. But in healthcare, we're relying on our team. Nurses, physicians, techs, respiratory therapists, administration. Everybody is all working together to get through the crisis that is currently in front of us. Because raise your hand if you want to run a code alone. I know, I don't. Why? Because it's impossible. Okay? Do you want one person on an ambulance? Nope. One person on a fire truck? Not happening. Or what about one person trying to do everything in the ICU? Absolutely not. Okay? There are whole teams dedicated to taking care of patients because of the skills that each team member brings to the table. I can't compound medications. I need a pharmacist for that. I can't make physical therapy plans. I need a physical therapist. I may be able to come up with some diagnoses or differential diagnoses, but I can't diagnose and I need treatment plans, and so I need a physician or a practitioner to develop those so that I can implement them. Our patients suffer when the teamwork breaks down, and that's why strong working relationships and teamwork matters. That's why good communication matters, why trust matters. And I think the best teams are the ones that don't need to say a whole lot when the pressure hits because everyone already knows their role. They've practiced together. They've built that trust. Okay? Now that the emergency hits, it's done. Okay? The room gets loud and everyone can still move because it's a well-oiled machine. And I say that because in a crisis, the team that is built before the crisis starts is the team that gets through the crisis. Okay? You cannot do this all by yourself. And honestly, you should not have to. Lastly, number 5, I want to talk about self-care. And I know I have beaten this topic into the ground, but that's why this podcast exists. But I keep bringing it up because healthcare clinicians are really, really good at forgetting about themselves. I don't know how many nights that I've had in the ICU where I've forgotten to go to the restroom, or I have forgot to fill my water bottle, or take a break, or even go to lunch. This week is a great example of that. But whether it's because you were short-staffed, or too many ambulances, or whatever it is, you know what I'm talking about, okay? And we have to do better. By neglecting ourselves, we are not doing anybody any good. It is not healthy. It's not good for us. It's not good for our patients. And if you can't be effective in a crisis, you are no good to anybody. So we have to take care of our physical health, our mental health, our emotional health, because I cannot show up completely drained and take care of patients, okay? My team relies on me, the patients rely on me, my family relies on me. And I think that's part of the hardest thing is that we don't admit when we need a break. We tell ourselves that we'll just rest after the shift is over, or I'll take a break after the next code, or I have vacation next week, okay? And then 6 months go by and we still haven't stopped long enough to refill our damn water bottle. So how do we fix this? What does this look like in real life? Self-care in real life. Take a break, drink some water, eat a snack, go to the gym after or before work, go for a walk, take up yoga, okay? Call a friend, see a therapist, take a nap, okay? Do something that makes you feel like a human being again. For me, that looks like going to the gym, going to yoga, going camping, traveling with my husband, and just making time to be a person outside of work. And I'll be honest, I've struggled with self-care for years because I have to keep reminding myself that I cannot pour from an empty cup, okay? And you've heard me say it before, but this job will take everything from you if you let it. So we have to protect our well-being, especially when things are not calm. Because if you don't take care of yourself, the crisis is going to eat you up and spit you back out. And it's going to get a lot harder as you continue to do this. Okay, your patience is going to get shorter, your thinking gets foggier, your tolerance gets lower, everything just feels heavier. And then the next crisis is going to hit you and you're running on fumes from the previous crisis. And it's going to build and build and build, and that's just not something that we can sustain, and it's not something that we should be proud of. So as we wrap up today's discussion, I hope that you feel a little bit more empowered to handle crisis situations when they show up. Okay, I want you to take the hard assignments and push yourself. I do. It's going to make you a better clinician. But remember that it's okay to be shaken by that crisis. If you need a minute, take a minute. Take a moment to breathe. Gather yourself. Okay, that is how you are going to grow. It's how you become a stronger clinician. It's not about pretending that the situation is easy. It's about how you handle it when it's hard. And some days, handling it well just means slowing down long enough to think. Some days it means asking for help. And on some days it means being the calm person in the room. So rely on your coworkers. Lean on them. Because you're never alone. You need your team to support you, and your team needs you to support them. So take a breath, or 20, compose yourself and assess the situation, come up with your game plan, and remember that while yes, we experience crisis, and yes, we have tips and tricks to get through this, it's always okay to talk about these experiences. That is why we are all here listening to this podcast. That's why we are telling these stories. That's why we keep showing up. Because by sharing these stories and our strategies and our tips and our tricks, we're building a stronger, more resilient healthcare community. So thank you for joining me on today's episode. If you found this episode helpful, please share it with somebody who you think might need it. That could be a friend, that could be a colleague, whoever it is. Let's keep the conversation going. Please reach out to me on social media or send me an email with your thoughts, your experiences, anything that can help people with crisis management. And as always, until next time, take care of your patients and take care of yourself. Because in healthcare, you never really clock out.